Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Understanding shingles. Shingles is a condition that many people have heard of, but not everyone fully understands. Shingles, also known as herpes zoster, is a painful rash that can cause significant discomfort and distress. It is caused by the varicella zoster virus, which is the same virus responsible for chickenpox. This virus remains dormant in the body after a person has recovered from chickenpox, often hiding in nerve cells. After you have chickenpox, the virus stays in your body, lying inactive for years, sometimes even decades. It can reactivate later in life, causing shingles. Shingles is not contagious, meaning you cannot catch it from someone else. This means you cannot catch shingles from someone else, but the virus can be spread to someone who has never had chickenpox. However, someone who has never had chickenpox can get chickenpox from a person with shingles, as the virus can be transmitted through direct contact with the rash. Shingles is more common in older adults, particularly those over the age of 50. People with weakened immune systems, such as those undergoing chemotherapy or living with chronic illnesses, are also at increased risk. Understanding the causes, symptoms, and prevention of shingles is important for managing the condition and reducing its impact. This knowledge can help you protect yourself and your loved ones, ensuring better health and well-being for everyone. The varicella zoster virus causes shingles, a painful rash that can appear anywhere on your body. This virus remains dormant in your body after you have chickenpox, hiding in nerve tissues near your spinal cord and brain. We don't fully understand why the virus reactivates, but it can resurface years later, causing shingles. Several factors can increase your risk of developing shingles, making it more likely for the virus to reactivate. Age is a major risk factor. As you get older, your immune system naturally weakens, making it easier for the virus to reactivate. Your risk increases significantly as you get older, particularly after the age of 50. Having a weakened immune system is another risk factor. This can be due to various reasons, including certain medical conditions. Conditions like HIV/AIDS or cancer can severely compromise your immune system, making you more vulnerable to shingles. Medications that suppress the immune system, such as those used after organ transplantation, can also increase your risk of developing shingles. Stress is thought to be a potential trigger for shingles. Chronic stress can weaken your immune system over time. While stress alone may not cause shingles, it can weaken your immune system, making it easier for the virus to reactivate. This weakened state makes you more susceptible to the virus reactivating, leading to the painful condition known as shingles. Shingles typically starts with pain or tingling on one side of the body. This is followed by a red blistering rash in the same area. The rash usually appears on the torso, but it can also occur on the face, neck, or limbs. Other common symptoms include itching, burning, or numbness in the affected area. Some people may experience fever, headache, chills, or fatigue. The shingles rash usually lasts for 2 to 4 weeks. The pain can sometimes linger for months or even years. This is known as post-herpetic neuralgia. Section 4. Diagnosis and treatment. Seeking help and finding relief. If you suspect you have shingles, it's important to see your doctor. Early diagnosis and treatment can help shorten the duration of the illness and reduce the risk of complications. Doctors usually diagnose shingles based on your medical history and a physical exam. They will look for the characteristic rash and ask about your symptoms. Treatment for shingles typically involves antiviral medications. These medications can help reduce the severity and duration of the rash and pain. Pain relievers can also be used to manage the discomfort. Section 5. Prevention, protecting yourself from shingles. There are 2 vaccines available to help prevent shingles, Zostavax and Shingrix. Both vaccines have been shown to significantly reduce the risk of developing shingles, a painful rash caused by the reactivation of the chickenpox virus. Shingrix is the preferred vaccine. It has been proven to be more effective in preventing shingles and its complications. It is more effective than Zostavax, offering stronger and longer-lasting protection. The Centers for Disease Control and Prevention, or CDC, recommends that adults aged 50 and older get 2 doses of Shingrix. This recommendation is based on extensive research showing the vaccine's high efficacy in older adults. This vaccine can reduce your risk of developing shingles and post-herpetic neuralgia, a condition that causes severe nerve pain. Maintaining a healthy lifestyle is also important for shingles prevention. A strong immune system can help your body fight off infections and reduce the likelihood of shingles. This includes eating a balanced diet, getting enough sleep, exercising regularly, and managing stress. These habits can boost your overall health and well-being. By taking steps to prevent shingles, you can protect yourself from this painful and potentially debilitating disease. Stay informed, stay healthy, and take proactive measures to safeguard your health. UMCC, your ultimate medical consultant connectors.